DHHS. My name is Peter Kaufman. I'm the budget director for DHHS. And just wanted to start out welcoming all those that are here in the room and those that are online. We did that thing beforehand, and we understand that the volume is working well. Here I say there's issues, please put so in the chat on online meetings so we can try and address them. Also, one quick word of warning: the room here, there's microphones hanging down from the ceiling. All of them are active, and so any conversations that you have here in the audience, it has been muted before we started. It was muted, but I have to now muted so that if there's any questions here in the audience, those can do that as well. And so just be careful and aware of the noise level if there's lots of conversations going on with the audience. So again, I'm the budget director for DHHS and help manage the process of reporting on fee changes. We submitted recently to the Governor's Office of Planning and Budget our proposed changes to our fee schedule. We now are, according to statute, as statute requires, we are holding this public fee hearing to allow for the public to comment on the proposed fee changes that we have. The next step after this would be any needed revisions and then presenting it to the legislature for their consideration during the upcoming general session. So we are just going to go down the agenda that's being shared online. Montana, if you can scroll down to the first part as well. We have each of our operational units that are part of DHHS that have fees are all represented here in the room. They're listed on the agenda. Whether or not they had changes or whether there was no changes to their fee schedule, we've asked each of these individuals, representatives from these divisions or offices, operational units, to come up to the podium here and either state whether there was changes in their fee schedule or no changes at all. If there were changes, to briefly describe those changes and then allow for public comment. So I ask each of the individuals here on the agenda as you come up, please remember to introduce yourself, which operational unit you represent, and then describe either no changes or changes, and briefly discuss those changes if needed. And then ask for public comment. Please pause to see if there's public comments here in the room or online. And then once that is complete, the public comment is finished, you can sit down and the next person will stand up and present on their fees. So with that, I think we'll get started with Ryan Roberts.
Good morning, everyone. I'm Ryan Roberts. I'm the Assistant Director of the Office of Finance for the department. I am representing the Executive Director's Office of the fee changes that we are having this year in that area. So as we went through the process of reviewing the fees that we had set for this office, we identified a number of fees associated with the Government Records Access Management Act, GRAMA, which were duplicative or which were archaic, so to speak, ones that we didn't use in that process. So we went through the process of eliminating fees that were no longer necessary for our government request process. And so we have eliminated those fees. As I stand up for public access, public affairs and education, that also has fees that are related to GRAMA that we eliminated. But essentially, we don't have any fees that we're increasing. We've just eliminated fees associated with GRAMA this year. Are there any questions regarding those changes?
I had one, Ryan.
Yes.
This might be under the archaic fee that you explained, but so have you ever recently mailed anything for grandma?
We typically send our requests electronically. That's usually the means of how we respond. If we do mail anything related to our request, we can use the expedited shipping fee that we have established. You know, the mailing fee that we're eliminating was up to $100. To the department, we would understand that we could charge up to not $100 every time we mail something, but to the public, we didn't know, you know, how that would be perceived, and we didn't want that to be a limiting factor to grant a request. And so we will use the expedited shipping fee if we need to. That's a fee that we still have on our fee schedule, but most of our requests are responded to electronically.
Thank you. And then do you anticipate the $20 will cover your shipping costs, or are we going to be subsidizing it?
No, we have just, the expedited shipping fee is set based upon the cost that we would incur.
Okay, thank you.
Thank you. Any other questions?
I'm legislator. State registrar. The Office of Vital Records and Statistics has changes that they are requested for the 3 different fees that we have. All of them are associated with updating our online system that we plan to blow out in the early calendar year 2029. Other technology is the GovPay contractor that is vendor for the online ordering system. And the fee changes are all pass-through fees for Tyler Technology. The new system will the new system will provide better verification of identities, international patents, identity verification fee systems don't require. If the customer does not have a driver's license or state ID card, and the new system will be $2, so a change of 61 cents. If the customer fails to verify their identity, they will need to speak to a live person. The cost of that level of verification is $7. This is a new fee type to enhance the identity verification. In addition, the expedited shipping fee will increase from $17 to $30. Expedited shipping is an option and not required for an online order. Tyler Technology has a contract with UPS, so we will be shifting to UPS and using that contract as part of the new application. $30 shipping fee is required by the contract for the new system.
Speak up or talk right in the microphone. You just want to
I'm the director of the Office of Research and Evaluation, part of the division of data systems and evaluation. We have just 2 changes to today. We added the wording in the fee discounts for the rate components of the health. And we are updating custom services outreach charges and DHHS. Those people are changes. Questions? Thank you.
So you speak right in my hold it.
Okay, Ryan Roberts, again, Assistant Director of the Office of Finance Department, representing Public Affairs and Education and Outreach. So the fees that we had established in this office were principally related to grandma fees. We have consolidated those grandma fees into the Executive Director's office. So we will no longer be assessing those on the level of the Public Affairs and Education office, but rather to assess those, establish those fees out of the executive director's office to be used for the entire year. So those are the changes that we've had in this area. Any questions regarding those changes?
If I can ask one, Ryan.
Yep.
So it looks like public safety is reducing their background check fee. Is that already happened or is that happening in this cycle?
Yeah, good question. And that's the next area that I will be covering, is the offensive licensing and background checks. So if I don't answer your question, Russell, please follow up with another question. But we do have one change in the fees for licensing and background checks. And that is a reduction in the background screening fee that we charge on behalf of the Department of Public Safety. So we have recently been made aware that the FBI is reducing their background check fee from $11.25 to $10. And that will be effective January 1st of 2024. And so in order to be responsive to that reduction in fees assessed by the FBI, we are also reducing our background check fee from $33.25 to $32, and that's the portion that we remit to the Department of Public Safety. And so this fee reduction will go into effect on our fee schedule as of July 1st of 2025, fiscal year 26, but we anticipate reducing the fee that we charge from $33.25 to $32 beginning January 1st of 2025. Does that answer your question?
It does. You would want to do that via intent language for the mid-year, current year fee change, just FYI, but we can talk about that more later.
Okay, yeah, we'll know that. Any other questions? Thank you.
I know John was coming up here. We've been getting a lot of feedback from online participants that it's hard to hear. So we don't know the mic really close. You can see that you're Russell. I can see you on the screen. Can you hear me a little better? I don't know, a thumbs up with so. All right, well, we would like to come up and present and if you just hold the microphone really close, I think that's the best that we can do. We've had the time beforehand that it was working well, so we're not sure what the difference is here. So we'll have John go on next and just each that come up after it was hold the mic close by and speak clearly so that the transcript can also be recorded well. Thank you, Sanford.
I'm coming from that, an action manager at the DHHS, and I work with the Center for Medical Cannabis. The Center for Medical Cannabis is not proposing any increase or decreases or any changes in the fees. As I said, we have these certain fees that we had on there for that we were collecting for the Department of Agriculture age 24 as of August. We're now collecting those. We're now responsible for those fees with agriculture in beginning of fiscal 24 2072. If we do the same, I mean, we were proposing that at the time. Although there are some discussions on some things going on behind the scenes. And based on Ryan's realization, it looks like we need to go back and have two fees that have the background check is incorporated into those fees. We charge $68, and I think it's 25 cents for regarding caregivers and background checks. We'll change that by the $1.25. So we'll have to make that change. Are there any questions?
I have a question, John.
Sure.
how does your 6.8 million in revenue compare to your projected expenses for the Center for Cannabis?
Well, on, for 25, we're projecting, 6.7 million in revenues and 6.5 million in expenditures. So it's pretty close, 6.5 to 26. We are projecting right now that we would have more revenue than expenses. But again, there are discussions going on with lawmakers on uses of that capacity. And we know we have received questions from you. Those are being taken very seriously. A lot of discussions going on. We hope to put you in further discussions and other stakeholders and see if we can get some of those issues wrapped up in time to make changes to the fees that we need to full session. Any questions? Okay.
No. I'm gonna try one more thing off this other microphone. Okay. Is the sound any better without this other microphone? I guess
Super. It is amazing. We can actually hear.
Right. Our internal microphone, handheld one, I guess, was causing the problem. So, Russell, am I still soft spoken, or like, am I soft, or you can hear just fine?
2 thumbs up.
2 thumbs up. All right. Going forward, we'll leave this microphone off, and we just ask that the presenters speak up, and I think it should be well heard. So, Robert, you're next. Oh.
I'm here.
Okay, so I'm here. My name is Robert Paul. On behalf of a couple of programs, I'm the finance manager for clinical services. For the OME, we do have one change, and that is the cremation fee. And basically, as we did a cost analysis of that fee, it's just not bringing in the revenue to compensate for the expenses that we incur at the medical examiner's office to be able to do that service. So we've increased the fee. We did an extensive analysis. We didn't increase it to completely recuperate the cost because we were trying to keep the cost as low as we possibly could. But we did increase that fee from $150 to $200. So that's the only fee that we're proposing for the medical examiner's office. Are there any questions about that one?
I have one, Robert, if I may. So is it appropriate to ask what the cost would be to cover all the costs? Because you said you're not charging the full amount for your study.
Yes. So the analysis came back at just over $202, but $10 of that fee goes to vital records, so it would have been $212.
And fees are allowed to cover some indirect costs. Does that 212 include any indirect costs, or is that all just the direct costs?
That's all just direct costs.
Okay, thank you.
Yeah. Okay. And then for the lab, there's a number of fee changes at the lab. I don't know, should I go through every single fee change or just kind of discuss them?
Then, from now on,
Yeah.
however you like it, you're able to get the
Sure.
changes. However.
So I guess we'll start, let's see. We'll start with newborn screening. Newborn screening, the fee, we're proposing the fee to go up by $8 from $140 to $148. There are a few changes that are causing that fee to go up. Number one is a request from Community Health or CSHCN. What is it? Family Health. There's too many acronyms. Okay, Family Health. We've been paying them a certain amount for a number of years. It's been a set amount for the service that they do. And they came to us earlier in the year saying they needed more revenue. And so a portion of this fee is going to be going to them. Another portion of that fee will go to assay-related expenses for just number one, increased costs, like we're seeing everywhere. We have a number of increased costs for our supplies to be able to do the testing. Number two is personnel charges. Newborn screening doesn't receive general funding, so everything has to be reimbursed by this fee. So that's why this fee is going up. Any questions about newborn screening fee?
So Robert, I have one. I didn't catch if the entity that had it was asking for money was internal or external. Could you explain that a little bit more and what they're doing for the
Sure.
revenues they're receiving?
Sure, they're internal. So it's part of the newborn screening fee pays for the testing, but it also pays for the follow-up services. And internally at the lab, we do the vast majority of the follow-up services, but also Family Health does the hearing and the heart, congenital heart disorder follow-up service. So they perform a portion of the service that we charge the fee for. So that's why a portion of that goes to them.
Okay, so just to restate, previously it was not not a dollar per test going to them. It was a set amount, and now we're
It's a set
increasing it.
amount. Right.
Okay, thank you.
It's been the same for a number of years, 7, 8 years. So,
Okay. Thank you.
yeah. Moving on to other fees. So there are, I don't know, a handful of other fees that are changing within the lab. The majority of the reason for that is increased costs. We have increased hazardous waste costs that's been fairly significant. We have increased reagent costs which is our supplies. Equipment maintenance has gone way up. I mean, as we renew contracts for our equipment, the costs are just going up quite a bit. And unfortunately, these companies have a monopoly on the service agreement. So we don't have a whole lot of choice. We try to get the cost down as far as we can, and we do a good job, but it's still, those costs have just gone up. And then as well as personnel costs have gone up. So that's why we've got a number of fees that are going up. We've tried to keep it as minimal as we can, but there are some that are going up. And then we've also added a couple of fees for, number one, for chemistry, which is basically we work really quite a lot with the Department of Environmental Quality, and when they request different things, we try to bring those tests up. And so that's why we've got some new fees. Most of those come at the request of environmental quality. And then there's another new fee in infectious diseases, which is just a change of methodology and how we used to do a certain type of test. So those are the main reasons why we've got new fees. Any questions on those?
I have one, Robert, on just the nitrogen total standard method 4500N latchet one. We're deleting it. Is that just an outdated methodology? It looked like it used to bring in quite a bit of revenue.
Yes, it's an outdated methodology. That one's a little bit tricky because the equipment is so expensive to be able to do that test. So we've been sending that test out for a few months now. We're trying to bring it back, but it'll probably be a minute before we bring it back. And I don't have enough data. I just didn't have enough data to put together a fee or a projected fee. So that we're just taking this one off, and then when we're ready to bring it back, which is probably going to be at least another year and a half, then we'll add it on when I have better data.
So, sorry, just to restate, we haven't been doing this one internally anyways. We've just been kind of collecting money for somebody else to do the fee and sending it out and bringing it back.
Right,
and now we won't even be doing that service because we're taking the fee off the schedule?
So we will continue to do that, but when we work with DEQ, we've kind of They used to send all tests to us, and then we would send out tests to other labs, other reference labs. And that process has changed for a number of the tests. This one included where they just send it directly to the lab of their choice, which is usually Chemtech Ford.
Okay, so clients who need this service will go to DEQ directly, which is what they're doing now, and DEQ will handle the sending out. Okay, thanks.
Right, yeah. Any other questions on laboratory fee changes? Okay. And then health equity is on there, but there's no changes for health equity. Okay.
Hi, I'm Suzanne Bacon. I'm the Director of Operations for Correctional Health Services as well as the Office of Medical Examiners. There are 4 fees related to inmate co-pays, but there are no changes this year.
Gonna get up one more time. I know you might be sick of me changing things, but we got a lot of feedback. Obviously, at the beginning of the meeting, that the mic was causing issues with hearing. We're gonna ask that Linda come back up and present one more time on her fees. I think the other presentations, I understand that I think participants were able to hear well enough. Hopefully, of those, we're gonna ask Linda to present one more time on hers. And then from after Linda, we'll have one other change. Next on the list would be for population health. Brandy Franson, who's on the schedule, is not able to make it, so Mike Keogh Sarcino will be taking her place. And then Mike Keogh, you could just go into yours, your family health fees, and then we'll go to Sandy, so that you can do both of yours at the same time. So we'll have those changes. So Linda, come on up, and I think speaking loud this time hopefully will work better without the mic. So.
All right, second chance. I'm Linda Weiniger. I'm the director at the Office of Vital Records and Statistics and the State Registrar. The Office of Vital Records and Statistics is asking for changes to 3 of the fees that we have. All of them are associated with updating the online certificate ordering system that we plan to roll out in the early part of calendar year 2025. Tyler Technology is the government contractor that is the vendor for the online ordering system. And these changes are all pass-through fees to Tyler Technology. The new system will provide better verification of a customer's identity to determine entitlement to a certificate. The online identity verification fee on the current system is $1.39 if the customer does not have a driver's license or state ID. In the new system, the cost will be $2, a change of 61 cents. If the customer fails to verify their identity, they will need to speak with a live person. The cost for that level of verification is $7, and this is a fee that we're requesting titled Enhanced ID Verification. In addition, the expedited shipping fee will increase from $17 to $30. Expedited shipping is an option and not required. Tyler Technology has a contract with UPS, so we'll be shifting from FedEx to UPS and using that contract as a part of the new application. The $30 shipping fee is required by the contract for the new system. Any questions?
I have one. I'm just curious how you're going to charge the enhanced ID verification. So I guess they're online, they don't get to verify it because they don't have the right documentation. They then call in and the state adds a charge to their online order that's open. Is that kind of how it's going to be collected, or how will that $7 functionally be administered?
Actually, all of that is handled by Tyler Technology. It won't be our personnel that's doing that ID verification.
Oh, okay.
And I'm not sure how that's managed by them. It's just part of the new application and the service they provide.
Okay, thanks.
Any other questions? Okay, thank you.
Good afternoon. I'm Mikey Saracino. I am the financial manager for the Division of Family Health. As Taylor mentioned, I'm also here to speak about the fees in the Division of Population Health on behalf of Brandy Franson. So for Population Health, they just have 3 fees within that division, and they're requesting no changes this year. And then for Family Health, we have our Baby Watch Early Intervention participation fees. So these are fees that families pay as their contributions to receive early intervention services. 100% of these fees are passed through to our local early intervention agency. We are not requesting any change in the fee amount, but just some changes in fee quantities just to reflect what we build on average over the last year. And then there's a small increase in our overall projected family fee revenue for this coming year, just due to increased referrals to our early intervention program. Anybody have any questions?
Good afternoon. My name is Sandy Drollinger, and I'm financial manager with Division of Child Family Services. We would like to propose a new ICPC administrative fee in amount of $35 according to fiscal 2020. ICPC, their interstate compact on placement of children, is a statutory agreement authorizing the state to work together to ensure that children were placed across state lines for foster care or adoption to receive adequate protection and support. Utah DCFS is the lead agency communicating with other states and managing all of the required tracking. The proposed fee will help some of our personnel operating costs incurred by ICPC in order to complete the requests submitted by the residential treatment facilities, as well as for private adoption attorneys for those clients who are not DCFS, who are not in DCFS custody. Any questions or comments?
I have one. Maybe I can just try and restate what I heard you say and tell me if I got it wrong. So I think you said we are required as a state agency to administer interstate compact, and so there are for-profit entities that don't have DCFS custody children, but have children that they're serving who are going to ask for our services to help them place them in other states. Am I hearing you right?
Yes. That's correct, Russell.
Okay, and we decided to join, the legislature decided to join this interstate compact, or the agency did, or who?
I think that's a legislative, that's a federal requirement that all 50 states are part of ICPC.
Okay, usually compacts are voluntary, that's why I asked, so. Okay, all right, that's helpful. Thank you so much.
Thank you.
I have a comment, if I may. Question. So, and my name is Lance Rich, and I'm an attorney at Curtin McConkie. I handle primary adoption cases, and we certainly we appreciate the great work ICPC office does. Want them to receive the resources they need to continue to do that. I guess my question goes towards the funding. Of course, the ICPC has been around for many, many years. This is now a change in that it would require a fee where no fee had previously been required for agencies or private agencies or attorneys to process those requests. Ultimately, though, those costs get passed on to the adoptive parents. And I know that the legislature recently, and Senator Chris Wilson, who's the president of the Senate, has been very focused on trying to keep adoption costs down. And so my question is, I don't know if your department has reached out at all to Senator Wilson. I know last year, for example, he passed a bill that provided some state funding for birth parent pregnancy related services. And so I want to ask and see if there's been any communication there, and if there's any possibility that the legislature might provide some further funding for the office rather than putting that burden on the adopted parents.
Jerry, sure.
You'll introduce yourself as well. Absolutely.
I'm Stephen Sullivan. I'm the Support Services Administrator for DCFS, and ICPC falls under my purview. We have an ICPC administrator as well here to hopefully answer any questions I might be missing. To speak to our communications with any legislators specifically regarding private adoptions and fees, no, we haven't taken those measures that I'm aware of. What we're intending is, because over the years there's been significant increase in the volume of requests coming through our ICPC office. That increase has not been able to be maintained from a workload point of view. And so we're asking for a fee related to non-youth in custody ICPCs so that we can maintain a workforce that allows us to respond in a timely manner to all of our requests that come in, whether they're private or youth in custody.
And I guess as follow-up, if there hasn't been that outreach and communication with the legislature on this, would you be open to, I mean, I worked with Senator Wilson on this bill last year. He's been very open to any kind of measures that would reduce costs for families and adoption expenses. I'd be happy to help facilitate a communication with them if there's a possibility that the state might be able to provide some further funding there. I'm just thinking that may be worthwhile to have that communication and seeing if the legislature would come through with that funding request, before we go to the alternative.
Okay, and I think we would definitely be open to those types of communications. As many people are aware, our goal at DCFS is to ensure the safety of children through the strengthening of families, and any way we can do that, I think we wouldn't close any doors. We've got one of our deputy directors coming up, and I'll let her introduce herself and speak a little more on that.
Hi, I'm Sherry Romer, and I'm one of the assistant directors for DCFS. And I appreciate that information, and we would be happy to reach out to him. And you may be familiar, so if I'm saying something you're already familiar with, please forgive me. But typically, when we look at sort of what the needs are budgetarily for a division or an agency or an office, we look at the clients that we're directly serving, the services, the employees, the capacity to be able to provide those services. And it would be kind of unusual for us to reach out to a legislator to talk about, to ask for funding for clients that we don't personally serve. However, maybe the legislator is looking at things for some of the profit agencies as well to sort of offset that. I do know that adopting here in this country is very, very expensive. There are a lot of fees. And so I understand that already with the high cost that is being offered to people to work through that adoption, adding $35 to an already very expensive process could be taxing, most definitely. But we would be happy to have that conversation. We were fortunate enough to have a focus group this last summer with several people who came together to talk about sort of what our intentions were, kind of the purpose behind it. We had actually done this as well about 12 years ago, 13 years ago. And brought people in, and we actually had a public hearing, very similar to this, in which a lot of attorneys and also the residential treatment center director spoke up, and they kind of said some of the same things. We're pretty concerned about this. And they even said the next year we'll go on your behalf to the legislature to actually ask for this money if you will just not do this. And so we didn't do it and tried to provide that hospitality and extend that and continue to do the work and look for funding elsewhere. And unfortunately, we've now reached a point where sort of all the rabbit holes we've been down, we were unable to find the funding and be able to provide you with the same quality and timeliness of work. And so that's kind of why we're where we're at. But we'd definitely be more than happy to reach out to the legislator. Just to, to say that this comment was brought up and by whom, and kind of let them know what they're doing.
All right, thank you. There's a couple other questions that have shown up online. One is just a written one asking if ICPC fee of $35 per request. That's correct, right? Per request. Okay, now Mindy has raised her hand, and then Mindy, you can go ahead and ask your question, and then next CJ.
Hi, this is Lane Bagley with Sorensen's Ranch, we're a congregate care provider. So this question's been raised before, and I don't think we've ever been able to get a definitive answer, and that is for us providers that are providing services to out-of-state clients that are privately placed, do we actually indeed have to have an ICPC for those youth? I mean, we've been told conflicting things, and so where they are privately placed, can you give some direction on concretely if that ICPC really needs to be done for those privately placed kids?
Yes, and any child being placed across state lines, whether it's in a private setting or through state's custody, does indeed need to have the ICPC process as part of the overall process for the placement. We would be happy to meet with anyone individually to help clarify, but just as a blanket answer, yes, we do have to have ICPC on all state cross lines.
Yeah, and I might add, that's a great question, and I appreciate you bringing it up because it does continually come up. And we actually went nationally to ICPC to sort of see if there was a way to circumvent that, or to not have that in consideration. Because, as I said years ago, when we had this meeting, we had a couple of attorneys who said, "Gosh, we read this differently. We don't think that we actually, fall into this." So we appreciated that, and running to other attorneys that represented DCFS as well as talking with national folks. And yes, the position is that it doesn't apply. So thank you for asking.
Thank you.
All right, we'll go next to CJ.
Thank you. This is CJ with Provo Canyon School, and this may have been answered. I apologize if it has already. Is this going to be $35 per request per individual that comes into our facility, or is this the like monthly fee?
It would be per individual request.
So over the hundreds of children we serve throughout the year, each request would be $35?
That's accurate. For the initial request for ICPC involvement, it would be a $35 fee.
So that means
Okay.
if there's two lengths of the ICPC, that would be $35 for them together or for each section.
So it would be for the initial request, and my understanding is, and Amy, can you
Hear the question.
Oh, I was just wondering if it's 35 for each section of the segment of the ICPC, if it's a 3-stage.
Oh,
or if it's,
my apologies. I misunderstood your
I
question.
probably wasn't that clear.
It's
Sorry.
$35 for the initial request, and that covers all the process
Okay.
of ICPC.
Even the 3-state adoptions.
And our administrator said that includes even the 3-state adoptions.
And that's including each kid per each ICPC form.
Correct.
Good.
Thank you, CJ. Our last question is Donna.
Yeah, my name's Donna Pope. I'm the director of Heart to Heart Adoptions, which is a non-for-profit private adoption agency. And I don't have a question as much as I have a comment, and that's how much we very much appreciate how well we work with ICPC. We appreciate it very, very much. I do want to help you be aware that we work with the ICPC departments throughout all the United States. And with the exception of Colorado, I don't think any of the others charge a fee. And so this will be a precedent that others may follow. I don't know if they will or not. But nevertheless, I still support, because I support ICPC and what they do, and it's a vital role that they do. It will increase the cost a little bit, but not a lot. That's all I have.
Thank you so much for that comment, and it's much appreciated. While we are recognizing that we're adding a new fee that in years past hasn't existed, we're doing so for the purpose of being able to better serve our clientele and the children and families that need this assistance in their life. So thank you.
We have one other question that popped up from Trina. Trina, go ahead.
Yeah, my question is just related to how was it determined the $35 fee, and what is that mainly covering? Is that mainly just to support additional personnel to assist with the volume of the ICPCs? And yeah, I'm in one of the congregate care programs, and this will be a substantial increase for programs throughout the state. So just wanted to get some clarity on that.
Absolutely, that's an excellent question. Overall, the fee is geared more towards additional personnel for the ICPC team so that we can maintain appropriate contact standards and timeliness in our responses. Many of you have noticed over the past several months there's been a decline in being able to respond within those initial timeframes that we shoot for. Having additional staff is our goal so that we can then respond to all of those requests timely.
Financially, we use the average hourly cost of the employee times the estimate time it takes to complete a request. This is a very modest estimate because a lot of ICPC requests, as you may know, require many rounds of additional follow-up with multiple states.
And when will this new fee structure go into place? Sorry about that. I forgot to ask that.
No problem. It will begin fiscal year 26.
So that will be July 1st, 2025.
I don't see any other questions. Thank you.
Okay. I'll start over. I'm Carrie Smith. I'm the Deputy Director of the Office, and we are not requesting any fee changes. Are there any questions or comments?
I'm sorry, which units are you reviewing?
Recovery services, Office of Recovery Services for child support.
We have one question, raised hand, Sharice Brown. Was your question here for the Office of Recovery Services or back on the?
It was for the ICPC. I couldn't find the button fast enough, sorry. But I really quickly was just wondering, with the fee, how will that be assessed and paid? Would that be like billed per, like I wasn't clear on that part.
Okay, Sharice, just one moment. We'll finish up the Office of Recovery Services and just make sure that there's no questions here. Which I don't think there is, but we'll just make sure and let Carrie sit down. So thanks, Carrie. All right. We have Sandy coming back up from DCFS to help answer your question, Sharice.
Thank you.
So the proposed fee could be paid via check payment or cash. And we're also looking to other alternative, more like online web payment portal to see what's possible if the fee were approved by the state legislature.
And would the fees be like monthly billed, or like, I'm just trying to get an idea going back to my directors to be able to anticipate how we're going to be paying these out? Because I mean, we serve hundreds of kids a year as well. So just trying to figure out how that would be. Would we be doing it like per payment per kid, or per more of like a billing per month kind of thing?
The tentative plan is to have the payment submitted with the request. So per payment per request.
Thank you.
I'm Mark Strable. I'm Financial Manager for Juvenile Justice Youth Services. And I'm grateful to say we're going to be getting rid of some old grandma fees. I've worked with the division for a little over 19 years. Here's a list of fees that I've never seen us charge for: audio tape, compiling and recording in another format, mailing, which by the way, the authorized amount of that is $0. Paper for 25 cents for 10,000. Programmer, analyst, assistance required, and videotape. Archaic, right? Very grateful to be doing my things. Anybody have a heartburn on this at all? Okay, we're probably going to be looking at the department's $35 an hour fee, because that does have some applicability to us, but we have a lot of discussions we need to do before we even step to that door yet. So thank you.
Thanks, Mike.
My name is Genuine. I'm the financial manager on behalf of Medicaid today. We have the Medicaid application fee that is remained unchanged for this year. And then the chip fee that they are going away according to consolidated apportionment act last year. So, any comments or questions?
I have one, Jenny. If you don't know if I offhand, it's fine. But I know originally when we talked about the premiums going away and the reasons why, I believe that it was communicated that other cost sharing for healthcare services would be increased of the chip population. Do you know what the other changes are on the healthcare side that are offsetting the premiums that they're not paying?
So we losing the premium, so we're losing the revenue. But then at the same time, they're proposing to increase the copay to make up these offsets. So these copays that will be reflected in the claims that the provider.
Okay, so the copays would actually reduce our cost paid to the providers, and providers should be responsible now for collecting it, whereas previously the state was.
Yeah. So it's go to the expenses rather than the revenue right now. So
okay.
I can't say it 1-to-1, but that is where we can get the offset for now.
Okay, and I think I never introduced myself. Sorry for the record. Russell Franson, Office of Legislative Fiscal Analyst.
Thanks, Russell.
Kyle Larson, being counter extraordinaire for the Office of Substance Use and Mental Health. We have no changes for our fee schedule this year. Pretty vanilla. Any questions or comments? All right.
Hi, David Tolley, representing Mosby Hospital. We are also vanilla, no changes to our very few fees around for a long time. Any questions?
I do have one if I can.
Yeah.
So I'm just curious on the group charges, does that cover your cost, the $150 for the large groups?
We put some of the bill on that. The last analysis that we did, it's difficult to directly tie all of the aspects that would go into facilitating a group rental of any of our locations on campus. But so depending on how you look at it, it's pretty close to what we would incur on average.
Okay, thanks.
And I'm the finance manager. We do not have to change to our friendly for our media. Thank you.
All right, that concludes everyone that was on the agenda. We appreciate all of those that participated and presented on their fees. We appreciate the public comment and the information and feedback that you provided and questions. If you do have further questions about any of these fees, please reach out to me, Taylor Kaufman, or your contacts with whatever agency within DHHS that you work with. You're free to ask questions of them. So thank you everyone for coming. We appreciate your participation.
All right. Good job.